Really heard that the vagina is a self-cleansing organ. It cleans itself. That is very true. However, some of the things we do or do not do can lead to a disruption of the ecosystem and the pH of the vagina and can lead to infection and inflammation. That is what we call vaginitis. In this video, I'll be talking about the different types and causes of vaginitis and what we can do at home and when to visit the doctor. If you're interested in this topic, then please keep watching the video. Hi guys, my name is Olakoyo Playme. I'm a physiotherapist here in Nigeria. I film about women's health, women's lifestyle, and women's wellness. If it's something you are interested in, subscribe to the channel, join us. We're a community of like-minded women that are ready to take charge of our lives physically and mentally. If this is your first time, you're welcome. If this is not, you're welcome back. In today's video, I'll be talking about vaginitis. Vaginitis is just a compound name for infection and inflammation of the vagina. I'm talking about what the vagina is, the normal, and the different types of vaginitis and what we can do to reduce our chances of vaginitis. The vagina is a self-cleansing organ. That means it cleanses itself. Now, the vagina thrives in an acidic environment. The average pH of the vagina is between 3.8 to 4.2. This is protective because there are a lot of bacteria, good bacteria in our vagina. Now, this acidic environment helps to prevent the rapid multiplying of bacteria. There is a fixed amount that is needed for you to have an healthy vagina. So this acidic ecosystem helps to keep the vagina in proper healthy condition. So an increase in the pH, a decrease in the pH can affect the vagina and can lead to inflammation or infection. Note, about 75% of women would at one point in their life have vaginitis. So it can be caused by different things. It's not just a sexually transmitted disease. It can happen because of overwashing of the vagina, overwashing of the vulva, and I'll be talking about this in the video. I'll be mentioning 4 causes of vaginitis. The first one is the bacterial vaginosis, probably known as BV. BV is when there is an imbalance in the pH of the vagina. This is when the bad bacteria outgoes the good one. BV is not a sexually transmitted infection. However, it is popular among sexually active individuals, so it is not an STI, but it is seen mostly with people that are sexually active. Symptoms of BV include like a thin, milky, fish-like odor, secretion, most times after sex or menstruation. Also, you can have itching and burning sensation when you want to urinate. So if this is the symptom you have, you most likely have bacterial vaginosis. Like I said earlier, it is not an STI, but if you're sexually active, you're more prone to having it. Also, if you have numerous sexual partners, it can predispose you to having bacterial vaginosis. The second one is trichomoniasis. It is a sexually transmitted disease. It happens when there is like a vulva to vulva contact, and symptoms usually present after about 5 to 28 days of exposure. If you have trichomoniasis, it is important that both parties get treated. So when you have trichomoniasis, ensure that your partner is also treated for it. Trichomoniasis is caused by a single-celled protozoan parasite called Trichomonas vaginalis. Symptoms of trichomoniasis include frothy, greenish yellow secretion that has a foul smell. Also, you tend to have itching and burning when you pee. Also, you might have lower abdominal pain while you try to pee. So for trichomoniasis, the secretions you have is greenish or yellowish in color and also has a foul smell. If you have this, you probably have trichomoniasis. Obviously, this is not a cause to worry. There are drugs for it. So if you see these symptoms, ensure you go to your healthcare provider. Now, the reason why I'm making this video is for information's sake. There are different drugs for different vaginitis depending on the cause. So how you know which one and to know which antibiotics will work is when you know the symptoms. So if you use a random antibiotic, it might even make it worse. So you need to be aware about the smell. You need to be aware about the color and the pattern of the symptom. The third one we're talking about is what is popularly known as the yeast infection. Most times when people have itching of the vagina, the first thing that comes to your mind is yeast infection. Now, yeast infection is what is known as vulvovaginal candidiasis. It is the most common type of vaginitis. It is caused by a fungus named Candida. So when there is an increase in the fungus, then we say you have yeast infection. Yeast are always present in the vagina, but symptoms only happen when there is an overgrowth of this yeast. So there are different things that can cause a person to be prone to having yeast infection. First thing is a decrease in estrogen. As we grow older and hit menopause, there is a decrease in estrogen, and this can make you more prone to having yeast infection. Another is pregnancy and uncontrolled diabetes mellitus, the use of oral contraceptive when you douche your vagina, when you use perfumed soaps to wash your vulva and your vaginal areas. This can irritate the vagina and cause a multiplication of the yeast, and then you now find symptoms. Some of the symptoms of yeast infection is thick, milky discharge with the consistency of cheese. Then you have like small cuts around your vulva that makes that when you feel pain when you want to urinate, like it's sore around the vulva. Also, when you have itchy, red, swollen vulva, those are symptoms of yeast infection. The fourth one I want to talk about is the non-infectious vaginitis. These are not caused by bacteria, not fungus. These are just allergic reactions to some of the things we use. It could be soaps, lotions, detergents you use to wash your clothes. Sometimes we can even be sensitive to lubricants. All you need to do when you have this is just to stay away from the halogens. Now, if you have non-infectious vaginitis, you can have thick, mucus-like vaginal secretion. Also, you can have burning and itching sensation around your vagina. For all the others, the infectious vaginitis, you need to see your doctor, get a proper antibiotics for it, and if you have trichomoniasis, ensure you and your partner get treated. There are some of the things that we can do that can reduce our chances of having vaginitis and vaginal infection. The first thing is avoid wearing clothes that hold in heat and moisture. Your jeans, very tight jeans, it holds in moisture, and yeast infections can grow in this kind of atmosphere. Ensure you wear loose and breathable fabrics, especially if you're prone to having vaginitis, if you're prone to having yeast infection. If you have to wear pantyhose, ensure they have a cotton pads around the vaginal area. No wearing of nylon panties. These ones just holding moisture, and yeast infection can thrive in such environment. The second point is to not stay in your wet bathing suit or your sweaty workout clothes for too long. Immediately after swimming, immediately after working out, ensure that you change into dry clothes, because yeast infection thrive more in wet, moist environment. So ensure you're wearing breathable, dry clothes most of the time. And the third one is douching. Do not douche. Now, most people think vaginitis happens because you're dirty, you don't have good hygiene. Quite the opposite. When you over clean it, when you're cleaning it, you are actually disrupting the pH of the vagina itself, and can lead you to having vaginitis. That's infection and inflammation of the vagina. So as much as possible, do not douche. Do not douche. The fourth thing also is, do not wash your vulva with heavily scented soaps and perfumes. Our skin actually gets irritated by such. So if you have to wash your vulva, sure you use non-scented soaps that would not irritate the skin of your vulva and your vagina. Also, if you are prone to having vaginitis, you can try taking more of yogurt and probiotics. It is said to have lactobacillus, which helps to keep the pH of the vagina. The sixth one is have safe sex practices. Use condoms, use dental dams for oral sex. Ensure that you have and practice safe sex. It is very important in the fight against vaginitis. As soon as you start seeing weird discharge from your vagina, ensure that you visit your doctor as soon as possible. And lastly, ensure you have good feminine hygiene. Ensure you clean your sex toys if you use them. If you have to wipe your buttocks, ensure you're wiping from the front to the back, and I'm very sure things would improve from there. We've come to the end of this video. I'm very sure you've learned one thing or the other. If you have any questions, you can put them on the comment section. Please like this video, share to people around you, and let's keep living our best lives. I'll see you again in my next video. Bye.